Good afternoon, everyone, and welcome back from break. I am pleased that we have made it approximately halfway through our mental health summit today, and you're in for a treat now. We are very honored to be joined by Nance Roy, who is the Chief Clinical Officer of the JED Foundation. Dr. Roy not only serves in that role, but also as an assistant clinical professor at the Yale School of Medicine in the Department of Psychiatry. She has more than 20 years of experience as a psychologist working in college mental health. Formerly, she served as the Assistant Dean of Health and Wellness at Sarah Lawrence College, and most recently was the Associate Dean of Health and Wellness at Rhode Island School of Design. Her publications have focused on effective strategies for promoting emotional well-being among teens and young adults, as well as treatment and management of at-risk students on college campuses. She has been actively involved in strategic planning initiatives focusing in on a holistic approach to education, crisis management, and a public health model for delivery of care in high schools and on college campuses. Dr. Roy is a senior advisor of the National College Depression Partnership, serves on the Mental Health Task Force for the Ruderman Foundation, and has worked on mental health initiatives with the Surgeon General, wide-ranging public agencies and national associations, and with college and university systems across the country. Dr. Roy earned a BS degree from the University of Rhode Island, an MS degree from the University of North Carolina, and an EDD from Harvard University. Dr. Roy, we're so pleased to have you with us today and look forward to your presentation. Our Zoom screens are all yours.
Thank you. And thank you to the support person for advancing my slides. Thanks for having me. I've been able to join in to hear both the student and faculty and staff conversations, which I found very interesting and hopefully will be responding to somewhat as I talk with you about JED's comprehensive approach and our thoughts around sort of holistic support for students in educational settings. So with that, I will get started. If you could advance the slide, that'd be great. Just a bit about JED, just a couple minutes in case those of you who may not be familiar with JED can have some context. The JED Foundation was founded about 21 years ago now by a couple, Donna and Phil Satow, whose son Jed died by suicide when he was in college. And so when Donna and Phil, went to the school and met with the administrators, the administrators very genuinely and authentically asked, what would you have us do? We're a large institution, 20,000 students. What should we be doing around this issue? And again, it was 21 years ago. And not much was being done, as you might imagine, on suicide prevention or promoting mental health. So it really motivated Donna and Phil to walk away and think about what could they do to promote well-being and prevent suicide among college students, and hence started the foundation. I will say initially it was very much focused almost microscopically on suicide prevention, narrowly defined, and certainly, soon after its start, realized that if we really want to move the needle on suicide prevention, we need to move way upstream and really talk about prevention and promoting positive mental health. So that is where we are today. Next. So as most of you already are familiar with these dismal statistics, and I hate to start out with such bad news, but just to set the stage and remind us of why we're even talking about this. And this data is from the National College Health Assessment, which is supported by the American College Health Association. And so in the past year, these are the data that we have heard from our college students. 2 out of 3 feeling overwhelming anxiety, 1 out of 2 too depressed to function, 1 out of 3 binge drinking regularly, 1 out of 8 abusing prescription drugs. And I like to pause on this one because as we work with schools across the country. We're in almost 400 schools, and every time we meet with school folks, they always say, well, marijuana and alcohol are our 2 most frequently misused substances on our campus. And while we know that, we also know that prescription drugs are on the rise. As we also know, it has become an epidemic in our country, the opioid epidemic. And so we're really urging schools to keep their eyes open and stay ahead of the curve on this one so that we don't find ourselves with an epidemic on misuse of prescription drugs on our campuses, as we are finding in our society at large. Again, we're also now finding this was not something that the American College Health Association was measuring in the past, but certainly has become a looming issue. 2 out of 5 students struggling with food insecurity. Um, 1 out of 3 witnessing race-based discrimination. That was talked about a little bit earlier in terms of some of the stressors and traumas that we're experiencing nationally, certainly impacting college students, both societally as well as on campus. 1 out of 3 serious thoughts of suicide, 1 out of 10 engaging in self-injury, things non-suicidal self-injury like cutting, burning, other self-injurious and self-harmful behaviors. With 115 students attempting suicide every day and 1,400 dying by suicide in any given year. So clearly, and we know that suicide is the second leading cause of death on college campuses. So certainly some somber statistics. And yet, when we look at access to care and how many students are reaching out for care, a very small percentage of students on campus actually visit their counseling center. And as you've heard, it's not just at UNC Chapel Hill, but it's nationally. You know, every college counseling center is at peak demand, and is really struggling to keep up with the services that they're being asked to deliver. And we all, even though they're only seeing 12, on average, about 12 to 15% of the students on campus. And we do know that the students who are struggling the most with the most serious risks are often the least to present themselves on their own for help. And when you read about crises in the news, folks who have died by suicide, who are really struggling, more often than not, they were never seen by their counseling center and were unknown to the counseling center. So a combination really of a number of serious mental health trends and those folks who are struggling the most not seeking care. Next. Certainly, COVID has impacted, all of our mental health, I will say. I don't think I know of anyone who hasn't been somewhat stressed or distressed throughout the pandemic. This is, again, information from the American College Health Association and also the Active Minds group, which is a student advocacy group for mental health on campus. 2/3 of the students they spoke with reported financial stress, 60% worried about getting the virus, or even more so, worried that a family member, parent, grandparent would contract the virus. Difficult to access mental health care during the pandemic. We know that this was a significant concern for students who were being seen at their college counseling center and then perhaps went home to a different state during the pandemic, and because of licensing issues were unable to continue psychotherapy or psychiatry, medication management, etc., with their providers at school because of the interstate licensing restrictions. So many reporting increased stress, anxiety, disappointment, sadness, difficulty maintaining a routine. None of these things, I'm sure, come as a surprise to any of you. Next. So maybe we can move to potentially some more positive thoughts of hope and paths forward. And so I will begin by talking about JED's comprehensive approach to promoting mental health, and toward the end of reducing suicide and substance misuse among our college students. Let me first say that our model is one of the only evidence-based models that I'm aware of, and actually was developed by the Air Force, believe it or not, about 21 or so years ago. And at that time, the Air Force demonstrated statistically significant findings when they implemented this model consistently. And I will emphasize that when the military implements this model consistently, they have found a significant reduction not only in suicides, but anecdotally also found, even though they weren't looking for this, a reduction in domestic violence and substance misuse. So we took that model and adapted it for college students, and more recently just launched our high school program, which is a further adaptation of this model. I will say that the two underlying principles, and you've heard this, I think, throughout your conversations so far today, this is consistent with what you've heard, and that is, first, in order to really move the needle in promoting mental health and reducing suicide on campus, these issues must be seen as a campus-wide responsibility. You must take a public health approach where everyone has a role to play in promoting student well-being. And secondly, you need to have support from senior administration, from the top down. We have found again and again in the campuses we work with across the country that unless those two things are in place, campus-wide responsibility and buy-in from everyone on campus and support from senior leadership, you really won't be able to move the needle on these issues in any kind of long-term systemic way. So when we start to work with colleges, that is sort of our initial agreement, that we are all agreeing to these guiding principles as the underlying foundation of the work. And as you can see from this diagram, and if you want to read more, certainly you can go to our website where you will read more than you ever wanted to know about the JED campus approach, the JED comprehensive approach, and our campus program. And I'm going to talk about each one of these domains. As you can see, there are 7 domains: developing life skills, fostering a sense of connectedness and belonging, identifying students who may be struggling, help seeking, direct services, certainly, crisis management, policies, etc., restriction of access to lethal means. And so if you would advance the slide, I'm going to talk a little bit about each one and what we mean in terms of how the kinds of things we're thinking about schools need to be mindful of in each one of these domains. And that clearly, if you want to do the best you can in supporting mental health among your students on your campus, we believe all of these domains come into play, and cumulatively will offer a comprehensive approach to promoting well-being. So the first of which is life skills. And I heard some conversation around this in both the student, but especially the faculty and staff presentations, about helping students to develop basic life skills. We know that for many students, this is the first time when they go away to college. Many do go away to college. This is the first time they've left home, that they're living independently, navigating their way independently. That means managing schedules. I think I heard, folks talking about trying to find classes, managing time management, more academic related skills. But in addition to that, we're also talking about things as basic as doing your laundry, eating healthily, getting good sleep, moderating substance use. At home, most students who are living at home had support groups, whether it was family, friends. They had a, if you will, holding environment. And most students are leaving that holding environment when they go away to college. And we also do know, as I'll talk about in a minute, that they don't find ready-made groups that are going to replace those holding environments. So we need to really help students build basic life skills. Things like how to navigate conflict, how to manage disappointment, how to manage finances. I already talked a little bit about academic skills, time management, test anxiety, etc., nutrition, exercise, sleep. These are life skills that will serve students well throughout the lifespan. And as we know, many students have come from environments where much of this has been taken care of for them. And so that many are really starting out from scratch in trying to navigate their way, while at the same time living independently and trying to navigate an academic system. So it really is the setup, if you will, and especially if someone is struggling with a mental health issue, really the setup for a perfect storm. If you're already struggling and now you're trying to acclimate yourself to a new environment and you don't have a good foundation of life skills, it really can be a perfect storm and create a much more significant issue than otherwise would be the case. So life skills is key. And again, I will also say, in thinking about offering workshops, campaigns, etc., around life skills, that this be done again across campus. Not the counseling center putting up, workshops on how to develop life skills. That's great. But as I should have said a minute ago when I talked about public health approach and campus-wide responsibility for these issues, they really can no longer fall to health and counseling centers. They certainly have an important role to play, but they are only one very small cog in a very large wheel. And so we need to be offering all of the things I'm going to be talking about across campus. So in the fitness center, in the dean's office, in the dorms, in academic advisors' offices, as well as through health and counseling and wellness offices. But let's be sure that we're using a broad-minded approach as to where and how these supports and services and programs can be implemented. Next. Connectedness. We know in hearing from millions of especially first-year students that loneliness is the single biggest thing that they struggle with when they go to college, which again, given my comments a moment ago, certainly makes common sense, right? Not many students are coming to campus with their cohort of friends. And so finding your niche certainly can take some time. And we know that loneliness, and if you followed any of the research from the Surgeon General's office, you know this, loneliness is reaching epidemic proportions in our country, and certainly is no stranger to college students on college campuses. So thinking about, and we know that connectedness and a sense of belonging is a significant protective factor against emotional struggles and distress. So thinking about how your campus can promote a sense of connectedness among your students. We know that students turn to one another first before they go to anybody else when they're in distress. So what are you doing in terms of offering peer-to-peer connections, whether it be peer education, peer advocacy, peer counseling, peer mentoring? There are many, many forms of peer support programs, each of which are uniquely different, which I think is sometimes confusing as many folks use those terms interchangeably. But thinking about your peer programs on your campus, and are they serving students effectively? How are you using, if you have them, Greek and athletic systems on your campus, which oftentimes, depending on a campus, it varies clearly from campus to campus, but oftentimes play pretty large roles on campus socially. And so thinking about how those groups and or others on your campus can support mental health by being wellness ambassadors. I'm thinking about programs around tolerance, inclusiveness, how to connect disconnected students. At some point, if I don't have time to talk specifically about it today, but the equity and mental health framework, which is part of our work when we work with campuses across the country, and you can read more about it on our website, thinking about how are we reaching out and best supporting marginalized and typically unrepresented students on campus. BIPOC students, LGBTQ students, first generation students, and the list goes on. Do you have adequate spaces on your campus for students to gather organically, where they can simply just make connections, not necessarily go to a program, but have an opportunity just to connect, chat, talk, play a game, watch a TV show, whatever it might be? Again, generally speaking, how are you offering opportunities to promote connectedness? Next. Identifying students at risk. I like to change this actually, if Jed would give me permission, but I guess it means changing all of our promotional materials, so I don't know how successful I'll be. I'd like to change this to be identifying students who may be struggling. Because if we wait to identify and reach out to students when they're at risk, in my opinion, we've missed the boat and we've waited way too long. We need to, again, move the needle way. I must be hungry. I keep saying noodle instead of needle. We need to move the needle way upstream on this one. And by this, I mean reaching out and noticing when someone may just be beginning to struggle. So for example, if I'm a faculty member and I see, Nancy's usually pretty talkative in class. She's been kind of quiet lately. She just doesn't seem to be herself. Reach out to me. Nancy, looks like something might be going on. You're a little bit more quiet than usual. Can I help? Is there anything that you'd like to talk about? This is not rocket science. I heard a comment earlier, I think it was in the staff and faculty presentation, that faculty should not be asked to be therapists. And I couldn't agree more. We are not asking faculty or staff to be therapists, nor should they be. It is not their wheelhouse. It is not what they're trained to be. And this is not what we're asking for. What we're asking for instead is a warm hand, a gentle outreach from one human being to another, just as you would if you were sharing an office with a colleague and that person seemed to be under the weather in some way. It's human nature to say, hey, is everything okay? That's what we're asking for. And I can't tell you how far that goes for a young person when someone who organically in their community, who they revere and respect, takes a minute out of their day to ask how they're doing and if everything is okay. It goes a tremendously long way to helping them feel connected, that someone cares about them. And certainly if a student reveals an acute issue, know where to get them the professional help they may need. Connect them to the dean's office or the counseling center or wherever on your campus is the place to go. But I would say more often than not, it's that warm hand and outreach very early on before someone is breaking down crying in your office or talking about suicide or self-harm. Again, way upstream, reaching out when someone is just potentially beginning to struggle goes a tremendously long way. Someone mentioned, training for faculty and staff. We certainly promote training for everyone on campus, faculty, staff, and students. And our preference is brief targeted trainings for specific audiences on campus. I can tell you when I sit with teams on college campuses, and this is especially true for faculty, don't ask them to sit through an 8-hour training when about this much is relevant to them, or when the entire training is almost exclusively focused on crisis and identifying suicidality. It can be intimidating, and it can actually backfire, I believe, on what we're trying to promote. And so I can see the visible signs of relief when I talk with faculty about that's not what we're talking about. You don't need to diagnose if someone's depressed or anxious or suicidal. We just want you to reach out with a warm hand and a caring, kind word. Connect them to services and know where they are if you need them. But again, targeted, brief trainings where we can talk with, this is what a faculty member might see, and some verbiage that you could give them on how to reach out versus what a coach might see or what an RA might see. We all see students in different slices of life. And so what we're going to be looking for in terms of signs of struggle and how we're going to reach out will also look different. And this can be done in very short, brief, targeted educational exchanges. So I digress. You can tell that's one of my soapboxes. So I'll stop right now. But certainly as we work with UNC on thinking about educating faculty, staff, and students on identifying students who might be struggling, we will certainly be talking more about how to do this on your campus. Next. Help seeking, increasing help seeking. One good thing one good piece of good news that is, that we are finding is our stigma is on the decline among our students. High school and college students are reporting far less stigma in talking about mental health and reaching out for help than they have ever before in past years. Again, specific populations still struggle with reaching out for help. Certain cultural groups where there's high stigma in their country and in their culture for talking about struggles, whether they're mental health struggles or any other kind of struggles, certainly still looms large. But in general, stigma is on the decline, which is great. Um, In terms of continuing to encourage students reaching out for help, again, this notion that there is no wrong door to walk through for support on your campus. The goal is to develop a culture of caring and compassion, again, where there's no wrong door to walk through for support. And again, support, not therapy, but support, a warm hand, a caring word, connection to help if you need it. A campus culture that is open about talking about mental health, where there's on some campuses, many have had wonderfully successful storytelling campaigns, whether it's faculty on campus, administrators on campus, students on campus talking about their own struggles, how they've made it through, what successes they've had, what challenges they've had. We've had actually a fairly significant impact as we're seeing more and more, if you will, influencers talking about their mental health struggles, actors, actresses, athletes, uh, folks in the news that are talking about their own struggles and really advocating for mental health and setting their own boundaries, as we recently saw with the Olympics. So wonderfully positive role models that we can build on our campuses, offering things like online screening tools in addition to your direct service at your college counseling center, CBT cognitive behavioral therapy protocols, other screening tools. Many are also, and this I'll talk a little bit more about in direct services, but telehealth, telepsychiatry, teletherapy, which I think is soon to be rolled out, if not already, on your campus. And any campaigns around stigma reduction or positive mental health promotion really need to be designed and delivered by students. I could tell you I could work on campaigns all day long and they're going to fall on deaf ears for an 18 to 24-year-old. So really engaging your students because they will be able to tell you what is effective messaging and how to reach various populations on your campus. Next. Direct services, we also certainly look at your direct services. One huge concern we see that many campuses are just now moving to and haven't been doing is routinely screening for mental health in primary care. So that whenever you go to the health center for a cough, a broken ankle, whatever, the flu, you are screened for mental health. It's a brief screening. We know that upwards of 80% of students on campus, on many campuses, go to their health center. Again, cold, flu, whatever it might be. And only about 12 to 15% are going to their counseling center. So if we're not screening for mental health in primary care, then we are missing a ton of students who may otherwise fall through the cracks. And then how do we hold them? How do we hold students with mild to moderate symptomatology in primary care through self-care plans and other strategies that we certainly talk with schools about? Because you can refer all day long a student to the counseling center, and we know that more often than not, they never make it over there. So again, how do we screen and hold students with mild to moderate symptomatology in our primary care offices? How is primary care and the counseling center collaborating on shared patients? Does the right hand know what the left hand is doing? How are we promoting continuity of care? Do you have medication management? How is that navigated? If it's happening in the health center, how does the counseling folks know? And vice versa. If it's happening in counseling, how do the health people know what's going on with the student? And what is the referral system like? It is woefully inadequate if we're going to refer a student off campus for services to hand them 3 names. You might as well not hand them anything. Navigating the system is tremendously difficult for any of us, especially for a young person trying to navigate an insurance and healthcare system independently for the first time. So thinking about your robust referral system, how are you connected to providers in the community? Do you have MOUs, especially with hospitals where students may be hospitalized psychiatrically or physically in terms of discharge planning? And there's a whole host of issues that we need to look at there. Do you offer naloxone to your first responders on campus? That is the medication that will reverse an overdose. if someone is in fact overdosing? Do you have a recovery community? There's so much here. I could go on and on. Education around combining opiates and alcohol, especially for those students who may be legitimately prescribed an opiate-based medication, whether it's from an injury or post-surgery, recognizing that they can't also drink while they're on that medication. There's so much here. It's a session in and of itself, but I give you some of the highlights. Next. Crisis management procedures. Here we're really talking about policies on your campus. So and this was mentioned earlier, again, in your conversations about students who need to take time away. Are your medical leave policies consistent with recommended practices? Are they student friendly? Are they student supportive? Do you have parity between students who need to go out for medical, physical versus mental health concerns? Are the guidelines for going out and returning transparent and discussed in detail with students so they're not blindsided when they're ready to come back to campus? Do you have a one-stop shop for students when they need to take a leave? Are they having to run around campus to 20 different offices to get signatures in order to take a leave? There's many, many issues here with leave policies. Do you have a good postvention plan? Are people who have a role to play in postvention aware of the plan? Are they ready? Is the plan reviewed? Do you have debriefings when there is a tragedy as to how the plan went, what worked, what didn't work? There's plenty of good material out there on postvention and on medical leaves that we work with schools on to make sure that you have the best practices in place. What do you have in place for health insurance, tuition insurance? What are your parental notification policies when a student is in crisis? Again, there's quite a bit here. And as you know, this is also the stuff that oftentimes rises to the top, not only when there's tragedies on campus, but when students especially are feeling like there either hasn't been fair or due process in leave policies, AOD policies, and other things on campus. So a lot of work to do on many campuses with policy development. Next. And lastly, restricting access to potentially lethal means. We know that means restriction is the single evidence-based practice for reducing suicide. If you don't have access to lethal means, you can't die by suicide. Simple as that. So here we encourage schools to do an environmental scan of their campus to identify areas on campus where students could bring harm to themselves. For example, do tall buildings, do windows only open, 2 inches? For atriums, balconies, bridges, for places that are where students could bring harm to themselves. Are there barriers? Is there key card access only to rooftops? Are there security cameras? Is there increased security patrol in particularly dangerous areas? There's many, many ways that folks on campus can try to mitigate danger on their campus, but you can't do that without first doing a scan to identify those places that need attention. For some schools where firearms are allowed, what are the firearms policy? Do you have prescription drug return days so that there aren't unused prescriptions sort of floating around on your campus? What about lab safety? There's many things here we can talk about, and we do talk about with the schools that we work with. Next and last, I believe, is just very briefly the JED Campus program, which is how we implement the approach I just talked with you about. And so just really briefly, a 4-year initiative, which your school is joining with us just now, starts with building a multidisciplinary team, which is essential, and which actually your summit today is a good example of. Bringing all stakeholders together on your campus to form a multidisciplinary team to work with JED on promoting emotional well-being toward the end of reducing suicides and substance abuse on your campus. And so by that, we mean students, faculty, staff, and by staff, we mean not only, health, counseling, disability, but security, dining, academic advising, certainly athletics, Greek system if you have it, someone from the president's office, the provost's office, VP of student affairs, dean of students, you name it, coming together as a collective. We often find, as you are probably finding today in your experience of this day and listening to different constituent groups on your campus speak, they don't often come together and hear from one another. And oftentimes just coming together as a team is quite a learning experience in listening to the perspective of others, and oftentimes learning about what may be happening on your campus and other pockets of the community that you may not have known is going on. So building a multidisciplinary team, taking a JED assessment, which outlines all of the domains I just talked about, questions from each of those domains. Do you have this, and life skills? This, and connectedness, etc. To get a really good sense of where are you doing well and where are your gaps? The Healthy Mind Study administered to students. So we hear directly from students around what are your attitudes, awareness, and behaviors on the very things that we're trying to move the needle on systemically in your work with JED. And then working with JED to develop a strategic plan based on your gaps that will have concrete strategies, goals, and steps to attain those goals that you've identified in areas where there are gaps, tracking your progress over time, and reassessing at the end of the 4 years or the beginning of the 4th year, actually, to see where you've made the most progress, where you still need to do some work, and continuing to do that work in a sustainable way, even after your time with JED is over. So it's thinking about a comprehensive approach, implementing concrete strategies to identify not only where your gaps are, but how you're going to address them, and continuing to track and monitor that over time. Hopefully will be effective strategies for mitigating all of what you're talking about today in this summit and beyond. And that's it. Thank you. Please, please, I should say, go to the JED website. There are many, many, many free resources on our website that I think will be useful to you. I particularly will point out our Seize the Awkward campaign, which we did with the Ad Council, and that is a campaign, really a very brief vignettes of college students reaching out to one another when they notice that a friend might be struggling. Yeah, again, that way upstream, someone's just quiet or they seem a little off. How do you reach out as a peer? It's that awkward, it's called Seize the Awkward, because it's that awkward moment where something might be going on with your friend, but do you say something? Do you not say something? And to seize that awkward moment and take a stab in saying something. So that's one really easy thing to download and stream throughout your campus, but there are many, many other free resources on our website that I encourage you to take advantage of. So thank you.
Dr. Nance Roy, thank you so much for your presentation today. To keep with your theme, you've given us a lot to noodle on today, and we look forward to working with you and becoming a JED campus in the coming months. I'm pleased that we're running a little bit ahead of schedule, so Dr. Roy and everyone hopefully can go grab a quick bite of lunch, and we will reconvene back here at 1:05 for our next session. Thank you so much. See you soon.
Thank you.